NHS staff says they just don't have enough time to spend with patients nowadays. We're going to read more of this exclusive on The Guardian, guys. Let's go. Good morning, good afternoon, good evening, guys, wherever you are in the world. This is REGANELITE here with an exclusive from The Guardian. And the headline is most NHS staff say they don't have enough time to spend with patients. Exclusive reveals that a UK-wide poll of healthcare workers also reveals 75% believe the quality of care provided is falling. Spending time with your patients is vitally important to keep an eye and look after them. So where is that time going? Obviously, if they're not spending that time with them. Well, let's find out. Most NHS staff think they have too little time to help patients, and the quality of care the service provides is failing, a survey reveals. Medical and nursing group says the very worrying finding shows that hard-pressed staff cannot give patients as much attention as they would like because they are so busy. So, obviously, for those who don't know, there's been a severe lack of underfunding. There has been a lack of investment in the NHS, nowhere near enough the requirements needed. But most of all, there's been a severe shortage of staff, doctors, nurses, and the pay has been one of the biggest disputes, obviously, going on right now. And because of these things and because of these shortages, it means that basically doctors and nurses, they can't spend the time that they used to spend with them, and they're constantly on their feet, never taking breaks, working round the clock non-stop pretty much, which is not good at all. I mean, it's not just good, it's not just that, it's not just the care is not there for them, but also it's having a mental effect on mentally affecting the doctors and nurses as well, because they're constantly being run off their feet, trying to help everybody as much as they possibly can, and that's having a longer lasting damaging effects on them. Medical and nursing groups says the very worrying findings show that hard-pressed staff cannot give patients as much attention as they would like because they are so busy. In polling YouGov carried out for The Guardian, 71% of NHS staff who have direct contact with patients said they did not have the amount of time they would like to have helped them. A third, 34%, felt they had somewhat less than enough time, and 37% far less than enough time than just wanted. Almost a quarter, 23%, felt they had the right amount of time, while just 3% said they had more time than they wanted. The polling firm also asked a sample of doctors, nurses and other staff who have worked in the NHS for at least 5 years if the time they have to spend with patients has got better or worse since 2018. Nearly three quarters, 74%, replied worse, while just 2% said better. The survey presented a worrying picture of the intense pressures being felt at the NHS frontline. Those same personnel were asked if they thought the quality of care services able to offer has got better or worse over the last 5 years. Three quarters, 75%, said worse, including a third, 34%, who answered much worse, while 17% said about the same, and only 6% said better. However, a much smaller number, 56%, thought quality of care had declined in its own workplace. 3 in 10 said the care provided in their place of work had been about the same, and 12% replied better. So here's a graph here that YouGov has carried out. So YouGov carried out these findings for The Guardian. So time spent with a NHS, time spent with patients by NHS staff, percentage of respondents saying they agreed with the following statement related to their time of health. So you can see there, since 2018, 74%, up to nearly 75%, there. Did not have time. They did not have the time that they would like, 71%. Had far less than enough times, 37%. Had somewhat less than enough time, 34%. Had the right amount of time, 23%. Had more than they wanted, 3%, and had got better since 2018, 2%. So the vast majority have said higher. There's a tiny minority who think it's doing well, but I wouldn't say that. I think if you ask most people who go for appointments and checkups and whatnot, they probably don't get that as much. But it differs in different parts of the country. But the vast majority have said, but there is an issue, obviously. YouGov last month carried out an online survey of 1,058 NHS staff across the UK who were representative of the service 1.4 million strong workforce. Those polled also include ambulance workers, midwives and managers based in hospitals, healthcare and other settings. Not all respondents answered all questions. The Royal College of Nursing Chief Nursing Officer Nicola Ranger said, "These figures are a shocking indictment of the state of our NHS, with the vast majority of staff believing the quality of care that patients receive is getting worse. That more than 7 in 10 NHS staff feel they have less time than they would like to have had with patients is very worrying. It means the quality of care patients are receiving is suffering." Recent analysis by the Nuffield Trust and Health Foundation think tanks found that the quality of the NHS care has declined since 2012 across most of the 150 indicators they monitor, caused by austerity being imposed on the service. The chair of the Academic Medical Royal College, Dr. Jenny Dickinson, said the NHS was under greater strain than any other time in its 75-year history because of the COVID-19 pandemic and years of underfunding by successive governments, which has left it short-staffed. Dickinson said heavy staff workloads were hugely frustrating, not just for the people who needed the treatment, but also for NHS staff who generally want to spend more time with patients so that they can provide better quality care. The British Medical Association Deputy Chair of Council, Dr. Emma Roswick, said, "Our own research has found that many doctors feel morally distressed because we cannot give patients the care and support we want to, with insufficient staffing, lack of time and mental fatigue all major contributing factors." The King's Fund think tank carried out an international study to mark the NHS 75th anniversary on July the 5th, and it found that the UK's health service had fewer doctors, nurses, hospital beds and other vital resources than most of the 18 other rich countries studied. More positively, the YouGov poll also found despite the pressures felt, 73% of NHS staff were proud to work for the NHS and only 9% were embarrassed to do so. That's quite significant. That's quite a significant percentage there, that still, despite everything that's going on, despite the underfunding, despite everything that's being thrown at them by the Conservative government and private healthcares who have their hands in, who have private healthcares in American businesses and those who seek to privatise and rip up the NHS and everything it stands for, 73% of staff are still saying that they're still proud to work for the NHS, which is a nice positive there, which we much needed. Sophie Hitchcock, a senior researcher at YouGov, said, "With the NHS increasingly under pressure amid months of industrial action, this research highlights how NHS staff believe the quality of care has fallen over the past 5 years." She added, "Given the lack of time spent so many personal report, with winter often a particularly busy time for health service, it will be interesting to see how this translates to the experience of frontline NHS staff in the coming months." The Department of Health and Social Care declined to comment directly on the survey findings. A spokesperson highlighted that the government and NHS England's recent long-term workforce plan, which could bring a dramatic expansion in home-growth health professionals. The spokesperson added, there are already more than NHS staff caring for patients more than ever before, including 5,800 more doctors and over 14,900 more nurses compared to this time last year. Numbers, their response is numbers, rather than policy, when you hear from the government. So what does this mean, guys? What is this mean? This doesn't really. It should not come as a surprise that people are not getting that time, that social interaction with the doctors and nurses as much as they want to, and I think that's really important. Obviously, they're there to treat you and make you feel better, but at the same time, there's a mental aspect side of it. You know, these are human beings with emotions and feelings, just like the doctors and nurses with the patients. They need to have that little bit more breathing space with their patients, and they're not getting that at all. They're having to be run off their feet non-stop, which I've already mentioned, and it's disheartening. Because we've heard stories out there of some nurses, workers coming home after an exhausting day, coming back home and they're absolutely shattered, physically and mentally, from a day working in the NHS, working in these hospitals, in these conditions, in some hospitals that are completely falling apart with no works being put on or carried out on them whatsoever. This government does not care about the well-being of the nation at all. If they did, we would not be having the issues that we'd be having. The last 12 plus years of Conservative government have shown that because no one was saying anything negative about the NHS before 2010. No one. And we're having this rhetoric being thrown at us because of the consistent austerity and the underfunding and whatnot. But what do you guys think? Are you surprised by these numbers? Let me know what you guys think of these down in the comments below. Like, share and subscribe as always. Thank you very much for watching, and I will catch you all very, very soon.